You can run the Instagram account for them, social media.
Oh yeah, it's true. I could.
Yeah.
Hey guys, we're just logging into the Zoom here.
Come on in, Zoom.
I think it's just called Zoom. Thank you for attending. Sorry about yesterday. We went on live with the U of A, so we weren't engaging too much Instagram. We had it on, but you're here in the house, all the way in Toronto. The 6. There's some other nicknames, but I forget right now. I done have forgotten. I'm just gonna start the Zoom, and we'll have Zoom on. I'm gonna move this a little bit. There we go. We got people joining, and we are in Zoom. Good. I think we're good. I think I don't have anything important open.
It's credit card.
My information. Yeah. So we are 2 meters apart right now.
True.
It's a tease. Brandon's being a tease just by sitting there.
Yeah.
Just by sitting there. We'll give it a few minutes and then we'll get started.
Sounds good.
And it's going to be good because today's concussion. Brandon and I both did some education on concussion.
Mm-hmm.
He got a higher grade, so he's going to do most of this. Or was it pass-fail? It was pass-fail.
Probably pass.
There was an exam
There was.
at one point.
That's true.
But lots of this information is off peer-reviewed articles. So, yeah, which is why I like that course because... Hello, Samantha. How are you? I know you can't really respond via video or audio, but... So, anybody had a concussion before? Have you had a concussion before, Brandon?
Probably, but
Probably.
at the time wasn't diagnosed.
You weren't diagnosed. Did you, now looking back at it, symptoms-wise, do you
Yeah.
think you had a
So
concussion?
mine was probably, yeah, now looking back, I was playing lacrosse
Yeah.
for sure.
Oh, yeah.
But it just, we'll talk a little bit about it, but things have changed quite a bit, I'd say, in the last even
For sure.
5 years, probably.
Yeah, I had an interesting visit to a doctor back home when I got concussed. Samantha says we're great. Hey guys, hello back. I got a wheelbarrow to the head.
At the Home Depot?
Yeah, I was on a forklift. Someone didn't secure wheelbarrows to a pallet. I don't know how you forget to do that, but I was taking it down. I changed the rack, took the forks out, and got out of the forklift, and wheelbarrow fell on my head. Hit my head. I ended up going down on one knee. Didn't remember what happened. And there was a little gash or whatever, and the manager's like, oh yeah, we'll go to the doctor. I'm like, okay, because I was seeing stars. And I went to the doc, and he just did some tests with my eyes, and that was it. And I was sent back to work that same day.
Crazy.
I think I saw stars for 4 days and had a headache.
Crazy.
And my days off is when I felt better. I had 2 days off after 4.
Of course.
And, still in the forklift though.
Yeah. No WCB?
No WCB. I like how everyone at work is like, oh, I don't want to fill out any paperwork. It's like a huge gash on your hand. Oh, I'm not going to do this. Now looking back at it, it's that was a silly decision. So
yeah.
I think in the future, well, I don't think I'll have to work. Well, maybe I'll have to work that job. Who knows? I don't know if I was thinking about it. I'm like, I don't know if my forklift licenses are still valid.
Just
Forging?
rent one down the street there.
I can just take one from, I know how to start them.
Yeah, we'll practice our skills.
Some of them don't have keys.
Yeah.
So you just...
Yeah.
Oh, so many good memories of pain. So, concussion-wise, you can write any questions you want as we go, and then we'll look back at them later and answer them also. If we don't respond right away, no offense.
We will get to it.
We will get to you. Yeah, so we'll get started.
Perfect.
With concussion rehab. Thank you, Brandyn, for joining us 2 meters away from me.
Yeah.
So we got concussion rehab. We're going to talk about the process of a concussion. Lots of people might think it's one thing, but it's actually a little bit different than you might expect. Like instead of like a brain bruise or something like that, it's not the case. And we're gonna go through how to appropriately increase activity after a concussion, how to get back to sport or school, and kind of make it easy for people to understand. A lot of the times it's symptom management, but then you also get like cervical issues as well with concussion. If it's an impact, then you likely had some jarring of the neck as well. So we'll get into it. We'll go through any disclaimers, Brandyn?
Yeah, so just I think a little bit of background. Like Sunny was saying, we both did some training, similar course. Those who are interested out there, it's called Complete Concussion Management. I think Sunny did it a while ago.
Yeah, I think I did it when they first one of the first ones. I don't know. Yeah.
Yeah, and I think that was probably about maybe 8 months down the road that Sunny did his.
Yeah.
And then from my end as well, I worked as a trainer this year for Southside Athletic Club, one of their teams. So kind of got to see the first-hand front line, which is good because you kind of have both opinions as a health practitioner and a trainer, which is always the key for sure.
Yeah, which is cool because most of the concussions I see, majority, yes, I do see some from sport, majority are mostly motor vehicle accidents or WCB claims that I see. So.
All right, so without further ado.
Sorry, there was a message.
All good.
Sometimes I look off and just be like, but it's actually doing something. So we're going to go through a video first, right, Brandyn? You found this great video?
Yeah, a little intro
Should
video.
we play the whole thing here?
I think it's only like
5 minutes?
5 minutes.
5-minute video. I have seen this one and the whole series, or the documentary, but we're gonna play a video. It's nice. It's like school time where you get to watch a video and just chill out.
We'll roll in the TV and VCR stuff.
We don't have the popcorn, but we're gonna play this here for a few minutes.
It's scary. Like, what's the point? What's the point of playing professional sports? And it's supposed to be for the memories, you know. And you can't remember that anymore. It's really scary. We're in Florida, Orlando, Florida. I'm getting personal treatment for the head traumas that I sustained while playing in the NHL. I needed to come here because my speech was being slurred every month or every week, every day that went by. The sun hurt my eyes more and more. I was having headaches, problems sleeping, more mood swings, depression, anxiety. Flip a coin the night before I went to bed, and I wouldn't know how I'd wake up the next morning. It's not an easy proposition for a man with pride and ego to come here and assess the state of my brain, especially with a 3.5-year-old son.
Thanks for joining in, guys. We're just going through a video first, and we'll get right to it.
The quality of life that repetitive traumatic brain injuries rob from you is, I would give back all of my money. I would give back all of the time. You can take my name off the Stanley Cup twice over. I can't live like that anymore. You know, I just can't.
This is really working to kind of recalibrate your brain's perception of how you stand and how you occupy each space.
Alzheimer's, dementia, Parkinson's disease. You're 80% more likely to contract those three diseases if you have 3 or more concussions. That's fucking scary. I'd be scared if I was still playing in the NHL, if I was Sidney Crosby, if I was any one of those young kids. I wish that I had been given the information that was withheld from me while I played in the NHL, and I can't lay my head on the bed when I see injustice and I see people being treated in the same manner as my friend Steve Monroe had been treated.
That's good.
Yeah.
Okay, so I'm pausing it, putting it back onto the. Do you want to say anything about the video initially, or just?
Yeah, so I
Let that
think,
marinate.
with the video, if you haven't seen it, yeah, check it out. I think there's like Sonny said, there's a full documentary from the Players Tribute. That's where it's from.
Yeah.
Talking about just concussion in the NHL, and whoever doesn't know who that is, that's Daniel Carcillo, who was a NHL player. He's very opinionated with certain things. I'll give you a heads up with that, including different substance use. But having said that, he's a good advocate for concussion, a concussion advocate as far as prevention, and also just making sure people are aware of what's going on with them, especially in sport. Yeah, so check it out if you haven't already. But Sonny's going to talk about a little bit of background, I think.
A little bit of background. Concussion, as a lot of people know, it's an impact or significant trauma involving the head or the neck. So if you look at a motor vehicle accident, you might not hit your head on anything, but significant force, rotational, like acceleration, deceleration of the neck and head. It's also known as a mild traumatic brain injury. Brain injury resulting from biomechanical forces resulting in a complex pathophysiological process. So typically results in a rapid onset of short-lived impairment of neurologic function, and a lot of the times it does resolve spontaneously. And this is probably one of the reasons why a lot of people don't get help. They just assume they're going to be better in a certain amount of time. It's a functional disturbance rather than a macrostructural brain injury. And some other interesting stats, 7 to 10 days in athletes for resolution. So after a concussion, 7 to 10 days, 80 to 90% of the cases resolve. If you have greater than 10 days of symptoms, that usually occurs in 10 to 15% of the concussion. So majority of them get better in the 10 days and 10 to 15% linger on. Adolescents can be as long as 3 to 4 weeks. So they can take a little bit longer to recover from this type of injury. And now we got some drawing time with Brandyn.
Yeah.
Maybe I'll zoom in from a distance.
Yeah, there we go. Okay, so I'm just going to draw us a few things here.
Yes. Brandyn is drawing and you guys can watch.
Yeah. It's like, what's it called?
Neuron?
No, the painter guy on...
Oh, painter guy. Bob Ross.
Bob Ross.
I shouldn't laugh. Apparently he's a military drill sergeant.
Seriously?
Yeah, and he's like, I did so much yelling in my life that I just didn't want to yell anymore. So
that's kind of cool.
It was kind of a sad show because he was going through a really rough time. I shouldn't laugh.
Yeah, no kidding. That's
I'm
interesting.
just going to go back on Zoom and flip it back to Brandyn.
Okay, so yeah, like Sonny was talking about a little bit with the background of a concussion. And this is probably a typical thing most people educate you with concussion and kind of what's going on. So you can't talk about it without a little bit of neuroanatomy. It seems like a lot of stuff from that end. So on the top here we have a nerve cell. We got the cell body, the axon, and finally the dendrite. Again, the nerve cells make up your central nervous system with a few other specialized cells as well. So like Sonny said, in concussion injury, a lot of time you don't need to hit your head. Sometimes it just comes from a shearing and acceleration, deceleration force. What happens with these nerve cells is they kind of get stretched out a little bit and kind of pulled back and forth. So typically, or actually always, for the most part, what happens when the nerve cell fires, it has to go down the line by becoming depolarized. So it just means it gets excited and then it sends electric pulse down the line there as well. So what we were saying, when it kind of gets pulled and kind of pushed, what happens is there is a bit of an efflux. So going out of the cell, sodium tends to really get pulled out of the cell there itself. And what we see is these cells become excitatory in a state where they don't get stimulated by a neurotransmitter. So they kind of just like fire from getting sheared because of an efflux of certain chemicals. Sodium is one of the bigger ones there. And what happens is it starts to send a signal down the line and starts to activate when it typically doesn't activate. So cells, to stay alive, need energy, just like we need food to stay alive.
Yeah.
They need their own food, and their high energy food that they need, that our body makes, is known as ATP, adenosine triphosphate, very high energy type molecule. Brain usually demands quite a bit of it. Just us sitting throughout the day thinking and all that stuff uses quite a bit of glucose and those as well. And we can see on our little graph here on the y-axis, we got those levels, and on the bottom days. And typically right when that injury happens, since there's quite a demand, like I said, with the cells, those levels start to go down. And that's why people usually become pretty symptomatic when those first 3 days. This low point, Sonny knows what's called the nadir.
Yes, a nadir. Inside joke.
Yeah, anyways. The nadir, the lowest point, and that's typically that day 3 is usually the worst for people. So sometimes people will get the initial injury and they actually won't feel too bad, and maybe Sonny can comment on his experience. And then those next few days are usually brutal because they're just getting all the symptoms. Good news is with most individuals, like we talked about, symptoms start to decrease as those levels start to climb over those days, 20 to 30 days. And then those symptoms usually start to disappear kind of around that 7-day mark. Now the problem is though, and that's why we want to keep athletes healthy, is even though symptoms start to disappear, like Sonny said, we want to make sure we're fully recovered before we return to sport, right? Or in activities, and that's why there's certain protocols that we'll talk about a little bit later. Yeah.
That's a great explanation. That nadir point is going to be something that's going to come up a few times.
Yeah.
Which is a very important thing. I'm going to go screen share with Zoom. So sorry, Stephen. I know I forgot to go screen share. Did you want to go through the background videos first, Brandyn?
Was this right after?
Yeah, it's after the drawing time.
Oh yeah, awesome. So
okay.
I think there was just
a couple of videos. There was this one, Scott Moore.
Yeah, so Parachute Canada. So if you guys, this is their 2020 advertisement campaign. So you might have seen these on TV. Parachute Canada is just.
If an athlete falls down or gets hit, our immediate reaction is to ask, "Are you okay?" But if you feel the need to ask, you should get them checked too. It might be a concussion.
And then I can exit that one. Then we got the how to recognize a concussion.
Yep. That's awesome.
It's good music. So lots of conscious responsiveness is the first one. I know it's blocked out, but
we'll talk about a lot of these signs and symptoms a little bit later here, but these are very typical ones.
And if you guys want the links to the videos, just let us know and we can send you them.
Yep.
These videos are great just to get a really quick snapshot of what to look for, and they
great
are pretty good because some of the symptoms you don't always know are symptoms.
Yeah, so there's that kind of memory one Sonny was talking about, retrograde and anterograde amnesia.
Yeah, that was the weirdest part.
You had what, retrograde?
Yeah.
Yeah.
It was, definitely a weird experience.
Yeah.
That's a good call.
So there we go. So that immediate kind of recognition is one of those things that have changed quite a bit. I'd say being really reinforced over the last 5 to 10 years here.
Yeah, I think in the past it was just okay, you're good, go out there.
Good to go, yeah.
They do a couple tests and you're back out playing whatever sport that is.
Yeah.
That was it.
So so with that, having that in mind, so Parachute Canada, they work with the Government of Canada and Public Health in kind of like a task force, if you will, to kind of look at recent evidence and knowledge translation and concussion. And a lot of protocols have been, developed, and they'll take a look and make sure us as a community, as Canadians, have the right information to pass along. So typical concussion symptoms that people can feel, and it's not limited. Some people will feel a cluster of all of these or one or the other. And it comes from the background in the SCAT-5. It's just an assessment for athletes with concussions. It's been around for a long time. So this is the 5th version.
Yeah.
So stuff like headaches, pressure in your head, neck pain, nausea or vomiting. We'll talk about vomiting a little bit more in depth a little bit later. That's why it started there. Dizziness, blurred vision, balance problems, sensitivity to light, sensitivity to noise, feeling slowed down, feeling like in a fog, don't feel right, difficulty concentrating, difficulty remembering, fatigued or low energy, confusion, drowsiness, more emotional or irritable, sadness, nervous, anxious, trouble falling asleep. So as you can see, a lot of symptoms, there's quite a few of them, and some individuals might feel one, but others might feel more symptomatic in certain areas. And I guess, Sonny, maybe from your experience, what was your big ones that you kind of hit on that list there?
I would hit headache, pressure in head, blurred vision. Didn't have any light issues or noise issues. Confusion was one.
Yeah.
Difficulty concentrating, didn't feel right, and yeah, that was mine. Just thinking about it off the top of my head.
Yeah, I know when I was playing lacrosse and I had that concussion, that just was undiagnosed, but just at the time. But things I felt were definitely headache and probably that like drowsiness and like general like feeling slowed down. Those were things that were quite prevalent and that I was feeling at the time there. Okay, so as clinicians, as even people and parents should be aware, really note serious injuries first. So the little chart on the left is known as the Canadian CT head rules. So this is for Sonny. Probably should have got this examined by a doctor a little more closer because he did get struck in the head.
Oh yeah.
So the GCS score, that's known as the Glasgow Coma score. This is very important to clinicians, trainers, people. If anybody has any symptom or any score on that coma score, they are no longer a concussion. They are probably a brain injury. So that's a big one. It goes to 15. If you score anything on that, you probably need to go see the doctor, get CT like it's saying here. Suspected open or depressed skull fracture. Again, in Sonny's case, he had a wound, so probably there should have been some sort of follow-up. Any signs of basal skull fracture. So those, that's like our facial skull bone fracture. So if the raccoon eyes, like gets puffed out, those are usually indications that some of those facial bones could have got damaged. And this is what I said, vomiting. So generally vomiting more than 2 episodes after an injury, red flag for sure. That's not typical. That's something that people should go to the hospital for. Being older, that's just a risk factor over 65. And there's some other medium risks. So amnesia before the impact greater than 30 minutes. So again, Sonny probably falls in that zone. We're checking a lot of those on the list there that should have been followed up with. And then dangerous mechanism. So yeah, getting hit on the head with a wheelbarrow or getting tackled or, falling off stairs and, you fall off the ladder and you wake up, 5 minutes later and you don't know how you fell off that ladder. That's that dangerous kind of mechanism that we're kind of talking about. Or in so there's contact sports. So those are sports where contact can happen. So like basketball would be considered a contact sports. Versus a combat sports and kind of a collision sports are more classified where it's going to happen. So like football, you're probably going to get tackled. Hockey, you're probably going to get hit at some time. Combat sports like MMA, boxing, you're probably going to get hit in the head at some point. So those are the difference between a contact and also a collision and combat sport where things are going to happen there as well. So those are just general things that why people get CTs and what kind of doctors look at and to see if that's a possibility. A few other risk factors are like if you're intoxicated at the time, that's usually not like a good thing, although it does happen, right? Where people can't remember because they might have been like drunk or something like that. But it potentially has an implication being more dangerous because they can't remember and they don't know what happened, so their history is not usually the best with that as well. It does happen, of course. Those are with risk factors there from that end. And this on the right, there's that Glasgow Coma score if anybody's interested. It kind of goes through different sections. Typically, as physios in private practice, we never, ever use this, ever. You're probably going to see this in the hospital and somebody else does it, not a physio. You'll probably read it in the chart. But again, like I said, if anything on there is a check or you get any score, that's like going to the hospital right away type stuff. And people can see like eye opening and motor response. Those are things that are like, Serious problems, yeah.
In my defense, with the wheelbarrow to the head, I was first year college and
Yeah.
didn't know the seriousness of it.
Yeah, and that's one of those problems, right?
Yeah.
Okay, so really not serious injuries continue down the line. So as physios, doctors, typically things that we can do from our end, cranial nerve exam, that's something Sunny and we've done before, or many times. Definitely been trained to do that. Upper and lower extremity scan exams, neuroscans, to make sure reflexes, muscles, all those nerve sensations are kind of firing. Those have been kind of engraved in our heads as physios too. Coordination, so think of your balance tests, think about pronator drift tests, think about coordination tests like nose to finger, think about also like your toe tapping and all those ones that require quite a bit of coordination. That's what falls into there, and of course like a full C-spine exam that your doctor or physio would do, just to check the muscles, tenderness, check those big ligaments around your neck to make sure there's no serious pathology. So those are generally things where those serious things get ruled out. Again, if anything kind of checks on these lists, generally you're not going to be seeing a physio anymore. Yeah. You're probably going to be seeing somebody with the medical experience to handle that kind of trauma for sure.
And so why we need to rest. A lot of people, like now it's the 24 to 48 hour window to rest. And the reason why we rest is there's decreased cerebral oxygenation with associated decrease in cerebral blood flow that may result in profound hyperfusion of brain tissue. So for that first window, less blood going to the brain, not good. So you don't want to get out and get too active when if you exercise, your blood needs to be sent everywhere in the body. So you're increasing the demand of your system. So that's one big reason to rest. There's an ATP deficit that Brandyn was talking about, the nadir point. You want to be cognizant of that and vulnerability, so it prevents further injury. A big reason why we rest is you don't get hit in the head again. And that can lead to quite a few issues. Second impact syndrome could be one. That would be an extreme. It's not very common, but that could lead to death if you go to the worst case scenario.
But likely what Daniel Carcilla was talking about in his video, that's probably what likely could have happened.
Yes.
Not enough rest time.
Sounds like it was very close to happening.
Yeah.
Recovery of modulators. So Brandyn talked about the imbalance, so balanced calcium and potassium. That needs to be done, so that takes time. And post-traumatic vulnerability. So you're vulnerable during recovery just because of all those factors. And symptom resolution does not coincide with metabolic recovery. As Brandyn showed also that nadir point, as it goes up, you might be symptom free, but it doesn't mean everything has returned to normal. And that's why you want that rest. You do want some sort of rest period. And rest doesn't mean to just lay on the couch and do nothing. You can still do your activities of daily. Like if you need to cook and clean, cook and clean. That's fine. Yeah. Some people take it for face value and just say, nope, eyes closed. I'm going to go to, that's it. I'm just going to lay on the couch. Can't watch TV, can't do anything.
Which can lead to problems too, right?
Yeah. So you want to still, be active to the point you're still doing your activities of daily living, like taking care of yourself. If you're younger and live with your parents, then you can get away with not doing anything. But you got to eat. You need your nutrients. And I didn't miss any slides, did I? I don't think so. No. Yes. Okay. Good. Exercise guidelines. So this is a good guideline. This was also available in our course that we took. And this is pretty recent. It's from 2020, this particular article. And it's concussion management for children. And I think a lot of people can follow this. Children's a bit more conservative because they do take a little bit longer. One thing is they're not as developed. Myelination hasn't occurred yet, so they could be a little bit slower recovery. But so exercise guidelines. A big thing with all these phases is to take 24 hours between each phase. Like a day should pass between each step. So if you think about it, you got 2 days rest and then 6 phases, that's 8 days. And minimum. We talked to, sorry?
Minimum, right?
Yeah, minimum. So we talked about most concussions get better within 7 to 10 days. So this is to keep you safe within that 7 to 10 days and minimize risk. So the idea is you get hit in sport, you have one of the symptoms, then you start this program, and at best it'll take 7 days to get back to your sport. That way you're minimizing risk, right? It's not worth risking things. So phase 1, so this is a short phase of physical and cognitive rest with symptom guided activity. So 24 to 48 hours. You could do 5 minutes of light physical activity. So this is like walking, very slow bike riding, very, very gentle exercise. So after that, if that doesn't lead to increase in symptoms, and symptoms is unique to everybody. So I always tell people that have concussions, just write down what's different after the concussion. Like do you have a headache? Are you dizzy? Whatever it is, fatigue, write that down as a symptom. And whenever those occur with exercise or with anything, that's when you stop that activity. So if it's reading a book, newspaper, things like that, watching TV, once you feel that symptom, whatever it might be, that's your cutoff period, and you don't do any more than that. I'm sure Brandon would agree with that.
Yeah, absolutely. And in a lot of cases, that checklist you saw above, the SCAT-5, I think there's 22 symptoms on that list. We'll just give them that and then tell them to rate it 1 to 6 on each. And then they can kind of get a bit of a diary every day of how things are going.
So that's a good point. Number 2, so we got right over here, light exercise, no contact. So it's 15 to 30 minutes of light physical activity twice daily. So again, bike, very gentle jog or walk, nothing too crazy. So the next day, 24 hours, you're fine. There's no symptoms reproduced. The individual sport-specific activity, no contact. That's 2 30-minute physical activity sessions, and that's moderate. So getting a little bit more faster for running and biking. And that's 2 hours per day, right? So we got 2 bouts of the 30 minutes. You're still allowed to do the steps before, and then doing 2 30-minute bouts of more moderate exercise. And the thing is, if you have symptoms after this, you stay at that phase. If it's not too bad, the symptoms, you stay in that phase until the symptoms go away. If they get worse, you go back a step. That's a big thing to remember. And again, these things, if you follow them, these alone can help you incredibly. A lot of times people just don't listen to their bodies and get ahead of themselves. They just want to get back to their sport. Yeah. And then if you get, hit again, then you just prolong your healing recovery time. It's not like it's double, it's going to be exponential. So it could be months, right?
Yeah, and I think maybe Sunny might be a good comment here that adults are usually the worst, especially when it happens in adult sport or in life, because you feel embarrassed that it happened to you.
Yeah.
And then you're like, I just gotta get back to work and do my thing, but it's okay, no, you still need to take care of yourself. Mm-hmm. To like Sunny said, so you don't prolong the symptoms, which is the worst. Can be the worst thing.
Yeah, I see that quite a bit, and it's very uncomfortable. So after the third step, sport-specific practice with the team, no contact. That's 2 30-minute moderate to vigorous. So getting drills started and things like that. No more than 3 hours per day of total activity. So you got the steps before. Resistance training can begin there. 5, so if that goes fine, number 5, sport-specific practice with the team, contact. So that means full practice, scrimmage, that kind of stuff. And if that goes well, step 6 is return to full activity, sport, or gameplay. I do a lot of this kind of programming with the athletes with athletes or with any individual I work with. So if it's going to be, let's say a WCB claim or something like that, I'll still follow something like this and do a half day of work and slowly progressing, right? So if someone's working a heavy job, doing light activity and progressing from there. So a very good guideline, very safe guideline. You definitely want to continue monitoring your symptoms. How much time should there be between the 2 sport-specific physical activity sessions during step 3? That was all one step. So sorry, individual sports-specific activity, no contact. That's 2 30-minute physical activity sessions that are moderate. That step, there's going to be just the 2 30-minute bouts. A time between, I don't think there is, just until you catch your breath and there's no symptoms.
Yeah, so think about those ones, if you're a basketball player, for example, that would be usually you just shooting hoops on your own.
Yeah.
Maybe just bouncing the ball, dribbling the ball, working on some ball skills. Usually it doesn't involve any other teammates where there's a risk of like incidental contact.
Yeah, and the bouts of sessions, there's no real time limit in between, so
Yeah, and
just
then,
as you feel comfortable. So it doesn't have to be like, do one bout and then wait 4 hours and do another bout.
yeah, and then usually with my hockey players, for example, in that phase, I don't even have them on the ice at that time because there's always a risk of just like slipping. So usually they're doing like dry land stuff, like maybe working on some stick skills off the ice, maybe just getting that cardiovascular fitness up a bit. So that's kind of that specific type exercise.
Yeah, so that answers that question. I mean, between steps is going to be 24 hours.
Yes.
No matter what, even if you feel great, never increase the same day.
Yeah.
But yes, the bouts of activity, don't worry about waiting. Just kind of maybe just do it like your training session. So if you're doing 2-a-day training sessions, just like 1 in the morning, 1 in the afternoon, then just do your bouts then. Try to make it consistent with when you would train normally with the team. So that's a very good snapshot of activity and how to progress. And that can be applied to work and things like that too. It just has to be modified a bit. So, and work, if it's heavy, then consider that resistance training. So that would be step 4 automatically. So, and we could send this PowerPoint to anybody who wants that in detail. We have another one here that Brandyn will go through. Return to school after concussion. Oops, very similar to.
Yeah, so return to school, again, you think of this as even return to work if you're a working age person. This is from Parachute Canada, again, that resource I sent earlier. We'll definitely share that link, it's pretty valuable. So typically that first step, you can see cognitive and physical rest. Usually we tell most people to rest for 24 hours to 48. That generally just take it easy, start to read a few things if you can, play some games a little bit, like some board games, just get the brain a little bit active. But trying to stay away from binge watching Netflix or trying to study for an exam or trying to catch up on a bunch of reading. 24 or 40 hours, definitely take it easy. Within 24 hours or 48, if the symptoms go down, of course, like Sunny was saying before, then we'll try and progress to light cognitive activity. So there we go. Try and read some more stuff. Try and do a little bit of schoolwork if you can. Try not to do a lot of studying, a lot of organizing, all that kind of stuff from that end. And of course, if tolerated, try and get a little more of that computerized and phone use in. There's always an interesting thing when using a computer versus normal text if we're for reading, just because our eyes generally don't blink as much. We generally get a little bit more fatigue just from using computer screens, especially if there's a backlight or whatever. And then step number 2 there, we try and get a little bit more schoolwork. This person's playing with their dog in that picture. I like it. 45 minutes, that's where you should aim to, getting that little bit of activity going. Again, we're not at school at this time. We're just trying to maybe catch up on 30 to 40 minutes of homework or work in your office if you're an adult, of course. And then 3A, that's kind of when we try to return to school part-time with modifications. So we try and do maybe a half day or a few hours. Usually we say no test taking. Most kids generally really like that when we say that. Yeah. Usually we say no homework as well, just kind of what we need to do within the class. Usually we have another student take all the notes for that person. If the person needs an extra 5 minutes to get to their next class, we say, go do that, leave early, try and get the staff in the school to get you to that next class a little bit early. Just those modifications to get a little bit of a better return of that half day if that goes well. Then we try and do part-time with moderate work, so try and increase that load. Try and do a little bit of that stuff on your own, right? So start to take your own notes, try and do a little bit more work in class. And then 4A, if that goes really well, then we're going to return to a normal workload. So all test taking, try and do everything you normally would do with your workload at a part-time basis. If that goes really well, then you're going to just go full-time and get back to all the stuff that you typically do. Now you're probably wondering, especially with kids, that it gets tricky, right? We can all think back to high school and junior high. How many days did you feel tired in the morning and fatigued and not want to go to school? Maybe quite a bit. So parents generally know their kids the best. So that feedback from the parents will kind of get the best results there. And like some, we're all human. Sometimes we don't want to take that big test, and it makes us nervous and it makes us feel anxious. So, sometimes that needs to be taken into consideration. The reason why we try and return to school and social, like within those 3 days, for example, is because we definitely know if you're out of school for a month, it leads to a lot of really bad secondary psychosocial factors. You feel behind at school, you feel like you got so much work to catch up on that it just becomes such a big problem that has nothing to do with the original concussion, but can bring a lot of those social factors into play as well. So yeah.
Then we have the return to sports strategy, which I guess is pretty similar to.
Yeah, and this is just from Parachute. It's pretty bang on to the resource Sonny gave you, and probably if we looked at it, they probably maybe referenced, but this is their own version.
Yeah. And
what we usually see, it's 6 stages, but in reality it's actually 7, because the return to sport is usually done into 2 phases. Once you're cleared from the doctor there in that last step, that's usually a big one, that you're cleared to actually do the physical contact and everything is asymptomatic. And if we had, I don't know if this exists anymore, a transparency sheet. Mm-hmm. Remember those?
Yeah, those overheads.
On the overhead.
Oh gosh.
If we had the overhead transparency, and they would kind of correlate within the steps of cognitively and physically what you're kind of doing from that end as well. Typically we see with athletes, because athletes are generally more trained than the average person, we can probably agree on that point, that when they start to lose training, they feel like they're a little bit further behind and feeling aerobically, so definitely that light aerobic activity when it's tolerated. Usually we can try and encourage that to get going as quickly as possible if it feels okay, just so we can continue to move and prevent that good recovery.
And these steps coincide well with the return to school as well, so they can go together. I think with the progressions, it's just listening to your body the best you can.
Yeah, and of course being honest about it too,
yes,
right? Yeah.
Writing in a journal would be a good idea. We got Brandyn.
So baseline testing. Again, I think a few things from my perspective is that concussion is, there's a lot of information out there, and it's kind of and it sounds funny, like a sexy topic in media. There's a movie off of it, Concussion, right? There's a lot of things. So there's usually a big thing of baseline testing, right? So before a season, athletes getting baseline testing to get a better understanding of where they're at, and if a concussion does happen, if we have more information to make a better decision if they do have a concussion, and kind of going from that end, right? So do I think baseline testing is important? Well, I think it needs to be thought of as as a way where it's more information, right? It's not the end all and be all saying that, hey, once they run through the SCAT-5 and they pass it, they're good to go. Probably not, right? Every individual is totally different, and we just can't rely on a test or a cluster of testing to clear somebody back into play, right? And that's why Parachute Canada, for the most part, said, it's probably not that necessary. And why they said that, and I'll put a little asterisk there, is because they said if you have symptoms, just pull the athlete off the ice right away, or pull them off the field right away. If they're symptomatic, you come over to them, they're on the ground, they're on the ice, and they say, hey, I got a headache, I'm feeling dizzy. You're not going to run them through the SCAT-5 and they check out and you throw them back on. No, as a smart trainer, as a smart coach, as a smart parent, or principal at school, you'd probably say, no, you had symptoms, we're taking you out of the game right away, right? So that was their argument. It's that if you're symptomatic, you shouldn't be put into play, and it's just for the safety of the individual. And from a trainer, from my end, that was, that was really something I was enforced with my parents that I worked with. If there was any symptoms, I pulled them. I don't care if it was an important game or whatever. As a healthcare provider, that's the line I drew. It doesn't matter. It's my call. If you want to take the responsibility, go ahead. But that's my call. So, anyways, and maybe it's a debate.
Yes.
Maybe Sonny would agree with that.
Recognize and remove.
Yeah, recognize and remove.
I would agree with that. I know for me, I worked with a couple teams briefly, and Yeah, I'd pull them. This is like relates to any other topic too, with like ACL injuries and stuff.
Yeah.
You got the big game. That's always a scenario that happens, and I always tell athletes and parents, I'm like, is it worth affecting you for life? And usually the answer is no. And you just have to make do, because I mean, based on the data and everything, especially with more impacts, you don't want to turn into, unfortunately, like the video that we watched initially, you don't want that to happen as an extreme case. So
yeah, and then again, like with Sonny's perspective as well as, you know, you can feel pressured by coaches and parents, right? We're like, no, they gotta play, right?
Yeah.
So don't feel pressured. But usually with most people, if you talk to them about like what Sonny said, the long-term effects, they're usually like, okay, I understand.
That's one thing. Like
It's
in school,
tough.
we always like talk about ethical scenarios, and then when you practice, it happens more than you think. Like I had one athlete that had to get clearance through like Hockey Canada.
Yeah.
And the paperwork was pretty intimidating for me, and I do paperwork normally all day. And I was like caving into pressure, because I couldn't believe it that the parent, the coach, and the organization, not the organization, but the team wanted them to get back to play. And
crazy.
the athlete was the one saying, no, I don't want to.
Yeah.
And I was like, wow, all these people are like, it might just be the lack of education, right? I'm not saying those people were bad or saying the wrong thing. They just didn't know about, I think, the seriousness of the issue. And yeah, I didn't do it. And then I ended up treating this athlete, and kind of got close in terms of like a therapeutic relationship, and could have been really bad.
And Sonny had a big one there. Education is huge. So like University of Calgary has like a free educational session for concussions, and part of that is aimed at parents, coaches, just so they're like more knowledgeable. The more knowledge you have, it's like great. Okay, I understand that. You know, I understand when Sonny says no, this, you know, we can't go back on the field or whatever. So
it's a serious issue, and it's good to chat through it with another professional as well, and share your stories as well. We have one more slide left. You guys can start asking questions or typing them in, or thumbs up or thumbs down, or whatever emojis you want.
Yeah, so the last slide here, it's a big topic as well, but we've made it into one slide. Is post-concussion syndrome. So generally, any symptoms that fall out of that normal period of about 30 days. I think Sonny also had a resource here, so greater than 3 months. Generally fall into that post-concussion syndrome classification. It's just a classification based on time and symptoms, and it doesn't recover in the time frame. There's usually cognitive defects in the memory, and then 3 or more of the following symptoms: fatigue, sleep disturbance, headache, dizziness, irritability, affective disturbance, headaches, apathy, personality changes, insomnia, concentration difficulty. There is usually a whole list of symptoms that you can have that usually lingers on. I say with people that I've seen and treated in the past, usually it's like headaches usually seem to be like the ones that linger. Visual problems, we'll talk about that just in real brief detail. And then also feeling just that cognitive delay or feeling slowed down. Usually those are usually things that people, from my experience, tend to have for a while. Within the categories, lost the screen here.
Oh, I'll just flip the screen over here. Boom.
Sorry, I think there's one last little.
Oh, is there a little bit?
On there? That's okay. Generally, within post-concussion syndrome, they can fall into 5 categories in general. Visual and vestibular problems. So that's something, I think Rob did one on vestibularity and visual.
Yep.
Yeah, so that's awesome. That's neat. So you can see how detailed that can get into for treating, and usually physios do a really good job at that. And that's something that we usually work with our post-concussion people quite a bit as physios. We also They can also fall in the categories of vascular flow problems. So as Sunny was talking about, that blood flow towards the brain, sometimes there's problems with that just because people haven't been as active, blah, blah, blah. So that's why as physios, in our perspective, we try and get people moving and try and get that graded exercise going. Metabolic problems, those usually don't fall in our era. Those are more the medical doctors and other people that will work with that. Those are problems within the brain and processing, like metabolically still that might be off. That's something we don't typically do or we don't ever do, I should say. And then psychological factors, psychosocial factors, we do cross over into that. Sunny kind of hit a good one there, that one athlete feeling pressured, so that would kind of fall into that. I talked about one briefly about somebody being out of school for a month and they feel pressured just to get back into school and do well. That falls into those factors there. Usually traumatic accidents like vehicle rollovers, or even like, doesn't matter. Those usually can have those psychological factors of returning to sport, or even driving a car. People can get those symptoms back because of that. And of course, like Sunny said, cervicogenic stuff, C-spine, and that's why we usually, we even within that first week, usually start to treat and work on the neck if it's appropriate, of course, because a lot of those problems can become because of that whiplash that happened when you got smoked from behind in hockey, or when you got in that car accident. So that's, you can see a lot of crossover. And I think just as a last little thought from my end, concussion, the information is changing probably monthly. It's good there's so many researchers doing a good job and getting that information out there. It's something we shouldn't be scared of, though. I think those things have to be put into steps so that it kind of limits those risks. And as practitioners, management, I think, is the best word. We don't treat a concussion, definitely not. No. It's the natural recovery, but we manage it to the point where it's safe for people to go back to things. So, if you think if it happened to you, definitely there's something. The management process is so key. That's why I always encourage people: if you think you have symptoms or you feel it, go see somebody. Like don't write it off. Go see somebody.
Unfortunately, like a lot of the times when I see patients, it's mostly like post-concussion syndrome.
It's too late,
And then it's like, anytime I had an athlete, patient, like it doesn't even have to be an athlete, anyone that had a concussion from any cause, if they're in within the week, always good outcomes, really good outcomes. Like yes, you get some people, the odd couple that don't, but a lot of the times with motor vehicle accidents, WCV claims, they take so long to get managed. And then they come to you like day 40. And not saying it's a lost cause, like they will get better, but it just takes a long time. And then it's hard to re-educate and be like, okay, let's start the steps. And then they're like, well, I did steps 1 to 5, all these different orders. And then it's like, no, we got to reset. And then you just have to wait quite a bit of time between steps, I'd say. It's like, and that goes into the take home points is any symptoms you have, whether it's a headache, whatever it is, off sport, off activity, off the thing that caused it, and then that nadir point 3 to 5 days after the concussion is typically the lowest points. You want to watch out for that, and then don't always think I feel great. Like if you feel great within 4 days, still take some time. Like it's still time. If you do those steps, you're looking at 7 days to progress through. That's the fastest you should be getting back to, especially contact activity. And then looking out for, decreasing the risk of getting post-concussion syndrome. So if you get back too early, then you're gonna be more likely to have those symptoms linger for over 30 days. So perfect. I think that's a good breakdown of concussion. I think it's great. It's a huge topic. That's why it took a little bit longer to talk about it, but it's even the course that I did was like 3 days of just 8-9 hours of just quite a bit of dense material. Absolutely. Right? And don't think about it as a brain bruise, right? It's more the circuits that are kind of haywire and need to readjust. Exactly. Perfect. Let's ask questions if we got it. There's still just the one question we answered. That's good. So even as physios, people are like, well, why do I need to come in when I have this program? It's like Brandyn mentioned, you can also have the cervicogenic issues, and then you can still treat that gingerly, I guess. But
or the visual and vestibular issues.
In Rob's case,
a lot of people have that right away, and we'll start treating that right away. Which is it's great.
and that gets things just more comfortable, and then we get the education of, hey, it's good to do a little bit of aerobic activity.
Yes.
And like go ride your stationary bike or do something safe. I'd say go ride a bicycle, but you don't want to fall in.
Yeah, stationary bike's good.
Yeah, stationary bike's safe. We always like to be safe and conservative when it's appropriate,
When
and
it's
then get more aggressive when we can. So I think that's like a huge topic done well.
Yeah.
Thanks for
Thank you.
yeah, so if any further questions, you can always, there'll still be a few minutes, but you can always email us at info@pursuitofmotion.com, or direct message us. I'm having a lot of good conversations. I as in we, so I'm always trying to make it mysterious who's answering the Pursuit of Motion. Sometimes I say, oh, hey, I and me, and I'm like, oh, no. But yeah, we're having good discussions with individuals in the community, and the good thing is to screen for this and get some help quickly.
Yeah.
And then we're always here to help. So YouTube, we're gonna have stuff. We're gonna have this video on YouTube, so then that way we can refer to it later. Or if you question that you have a concussion, have a look through it. Look online. There's lots of resources for this.
Yeah.
And even watch that documentary.
Yeah. And then what we were talking about as well is, I think maybe we can all reflect back on it, is there's always going to be another big game. There's always going to be another big chance. So just keep that in mind as athletes. I know as a younger individual myself, it's hard to say there's going to be more opportunities, but there always is. Yeah. I don't think there's ever like a defining moment where, in sports, right? I don't think so.
I think if you're truly talented to the point where you're going to make it somewhere, it will happen.
Exactly.
If it's not going to, it's going to be hard to say one season's going to make a difference.
Make or break it. I agree.
And that's no offense to people that have thought like that in the past, but I think if you're truly, if you think you're truly talented, that's going to show through season to season. Your physical prime anyways at 25.
Yeah.
So you still got time.
We're
past the prime. So I still think I can make it to the Olympics for some sport, but haven't found the sport yet. Not great at anything. I like to try everything, but not great at anything. So, and then share your stories too, right? So if you guys have your stories, just write them out, send them to us, or we can always do an Instagram live with people. I think it's cool to touch base in the community.
Yeah.
And today's Thursday, right?
Yes.
That's not my post-concussion symptoms. That's just not knowing. We have Megan, a good friend and colleague of mine, that's going to come in and talk about the progressions for exercise, postnatal exercise. So that's going to be exciting. Looking forward to that. Last week we went through a lot of the theory and kind of described the exercise, and now we actually get to perform them. So it should be pretty fun. I think I'm going to be wearing some athletic wear tomorrow. So thank you. Thank you, Brandyn.
Thanks, everybody.
And we'll see you guys tomorrow. Peace out.